So can you actually die from a broken heart? Well, the answer is kind of yes, and it's a condition called Takotsubo Cardiomyopathy. We're going to break it down today, and trust me, if you're a future PA, you absolutely need to know this stuff.
All right, imagine this. You're in the ER, right? A patient comes in, classic heart attack presentation. We're talking crushing chest pain, they can't breathe, the EKG shows ST elevation, and their troponins are through the roof. So you do the right thing, you rush them to the cath lab. But then, plot twist, their coronary arteries are wide open, totally clear. What in the world is going on?
So that's the puzzle we're going to solve. We'll look at why it's such a great heart attack mimic, what triggers it, what to look for, how you actually figure it out, and what you do about it.
Okay, let's dive right in. The first thing you have to understand about Takotsubo is that it's an incredible mimic. So what is this thing really? At its core, Takotsubo is a temporary stunning of the heart muscle. It gets weak, but just for a while. And it's usually kicked off by a massive surge of catecholamines, your adrenaline, your fight-or-flight hormones. Now, here's the kicker. It looks and feels exactly like a heart attack, but the damage, the weakness, it doesn't map to a specific coronary artery. That's the key.
And the name is pretty cool, actually. Takotsubo is Japanese for an octopus pot. Why? Because during one of these events, the very bottom of the heart, the apex, just balloons out. It literally looks like one of those pots. It's a crazy visual, but it's the classic sign.
All right, so if it's not a blocked artery, then what is causing this? Let's get into the science of it, the how and why behind a broken heart.
Okay, get your highlighters out, because this is a huge PANCE pearl. Who gets this? Overwhelmingly, it's postmenopausal women. We're talking like 90% of all cases. The main idea here is that after menopause, the drop in estrogen might leave the heart more vulnerable.
Now, everyone calls it broken heart syndrome. And yeah, intense emotional stress is a classic trigger. But it's not always about that. Major physical stress, think surgery, a bad infection, even a stroke, is just as likely to cause it. You can even see it after some wild stuff like earthquakes or lightning strikes. The bottom line is any massive stressor, physical or emotional, can be the trigger.
And all those different triggers, they all funnel down to one thing, that insane surge of stress hormones. This flood of catecholamines just wreaks havoc. It's thought to directly poison the heart muscle cells, clamp down on the tiny coronary vessels, and just make the heart work way, way too hard. All of that together leads to that stunned ballooning ventricle.
Okay, so what are you going to see when this patient rolls into the ER? Well, this is where it gets really tricky. The symptoms are, for all intents and purposes, identical to a heart attack. Chest pain, can't breathe. There's nothing, absolutely nothing that's going to make you say, oh, this is Takotsubo right off the bat.
And if you think the EKG is going to help you out, think again. It's just as sneaky. You'll often see ST elevation and these deep T-wave inversions, especially in the anterior leads. I mean, that's the textbook EKG for a big anterior wall MI. Just looking at that printout, you have no way of knowing it's not a heart attack.
So if the patient looks like they're having a heart attack, and the EKG looks like they're having a heart attack, how on earth do you figure it out? The answer is in the workup. Here's how it plays out. Patient comes in with ACS symptoms. EKG and troponins are positive. Everything is screaming heart attack. You might get a hint on an echo. That's where you might see the apical ballooning we talked about. But the final, definitive aha moment, that comes in the cath lab. You go in expecting to find a blockage, and you find nothing. The coronary arteries are squeaky clean. That's when you know. So let's put it side by side. Takotsubo, normal arteries. MI, blocked arteries. Takotsubo, that weird apical ballooning. MI, the damage follows the path of a specific artery. The patient profile, mostly postmenopausal women for Takotsubo. And one piece of good news is that with Takotsubo, the heart function often recovers completely, whereas an MI can leave behind permanent scars.
Okay, so you've made the diagnosis in the cath lab. Now what? What's the treatment, and what does the future look like for these patients?
Well, at first, you're going to treat it just like a heart attack, mainly because until that cath report comes back, you think it's a heart attack. So that means things like aspirin, beta blockers, and ACE inhibitors. The goal is just to support the heart, help it rest and recover, and manage any scary complications that can pop up, like shock or bad arrhythmias.
All right, another big PANCE pearl coming at you. Long-term ACE inhibitors or ARBs have been shown to help people live longer. But here's the weird part. Beta blockers don't seem to have that same long-term benefit, which is kind of counterintuitive, right? You'd think for a condition driven by stress hormones, beta blockers would be the star, but the data says otherwise.
You know, for years, the thinking was that Takotsubo was kind of benign, like a scary event, but then people just got better. We now know that's not really the whole story. The data we have now paints a much more serious picture.
Get this, the death rate while patients are still in the hospital is about 4 to 5%. To put that into perspective for you, that's right on par with a STEMI, a full-blown major heart attack. So this is not something to take lightly in that acute phase. And it doesn't stop when they leave the hospital. The long-term risk is also pretty significant. We're talking a death rate of around 5.6% per patient year. So yeah, this is a serious diagnosis with real long-term consequences.
So if there is one single thing you take away from this, let it be this. Takotsubo is the ultimate heart attack impersonator, and you prove it. You nail the diagnosis in the cath lab when you find clean coronaries in a patient who, for all the world, looks like they're having a massive MI.
And that really leaves us with something to think about, doesn't it? Takotsubo is this incredible, dramatic example of the mind-body connection. I mean, if pure emotion or extreme stress can physically injure the heart, what does that tell us about how deeply connected our mental and physical health really are?